Доброго дня, шановні пані та панове.
Good afternoon, ladies and gentlemen. This is UCMC. We welcome everyone who joined us in the press room and is watching online. Our topic is why the draft law on public health is so important now. Good afternoon. I'm Lyubov Akulenko. I'm from the Ukrainian Center of European Policy. We specialize in the issues related to Euro integration and the European Association, and together with the Public Health Capital Organization, we are discussing why public health is so important now during pandemic. I would like to introduce the speakers. Some of the speakers will be offline, some will be online. We all will be in masks because we understand that now this is lockdown and we need to take care of the safety of everyone. We have Mezentseva, the deputy parliamentary head of the Parliamentary Committee on Integration of Ukraine to EU, Bachmaga, expert on vaccination from PH Capital, Natalia Kyrychenko from this organization, Fedir, Lapiy, the head of the National Technical Group of Experts on Immunization, and Oksana, Zholnovych, director of Department of Social Policy and Public Health of the Office of the President of Ukraine. We will have online Rada, who is the head of the subcommittee on ensuring epidemiological safety of the Committee of the Parliament on Health of the Nation, also Rodyna, the General Director of the Center of Public Health at Ministry of Public Health of Ukraine, Oleksandra, Yanovska, the representative of EU in Ukraine, Brandt, Siegel. He will join us from the US, from the Agency of Reducing Threats from the USA. We also expect to see Victor Leshko here, but I understand that we have many people with us now, and we would like to draw your attention to the fact how public health can help us in times of pandemic, and our event will be divided into two blocks. First, the presenters will speak, and then the journalists will be able to ask questions. I will raise my hand, which will mean that you have 1 minute left. Before I give the floor to Mezentseva, and this is the topic related to European integration. Before that, I would like to draw your attention to the fact that pandemic in 2020 showed that just medical measures are not sufficient. We need to do more, like following the trends, and also following the health of people, and that is what is related to just the sphere of public health. It's great that now we are adopting the law on public health, and I'm sure that during pandemic, this is the draft law which will help us a lot, because previously no one paid special attention to that. Maria, I know that you submitted some amendments to the draft law, and that was related to the draft law to become more Euro-Atlantic. Why have you joined drafting this law, and what is your position? Thank you. I believe we cannot but agree that all the draft laws on the issues of health, of vaccination, of cooperation of our country with all the world, and that is in the sphere of vaccination and preventing not just COVID but any diseases. These all are the priorities of the state. We work in the Ukrainian parliament, and There are just 9 MPs in our Committee on Euro Integration. We are trying to follow all the initiatives of our colleagues, and we are trying to help different committees. In this case, this is the Committee on Public Health, and that is where my colleague Ms. Bulach is working. We are trying to get integrated and get implemented all the requirements of the association agreement. And we are trying to have right norms included into the legislation. Today, it's not like a couple of years ago when we were talking about implementation, but today we have the situation of pandemic, and as Lyubov mentioned, the draft law 4142 is very important, and there are many norms which are to be implemented in this law. And what could be a somewhat problematic when we are talking about sanitary epidemic inspections, we just don't want to copy old norms. We would like to talk about norms of European directives. We are talking about epidemiological supervision of infectious and non-infectious diseases. Also, we are paying special attention to prevention measures. And we remember how comparing to our neighbors, Poland, for example, or Baltic states, or the antibiotic resistance is an issue. We have some result of self-treatment of people, which leads to very low resistance to antibiotics. And there are different types of COVID, there are different mutations, and the antibiotics which were applied as a standard scheme of treatment are not effective now. So we are talking about modern trends, and related to that, we submitted our amendments so that everything is clear, understandable, and transparent, and so that it all is according to the new updated system. We don't want to have some mix in the result. We would like to have a very good and transparent approach. And we believe now that the draft law, on the other hand, does not defend the sector of public health from political influence, and we introduce some amendments related to that, but also the norms of law. And I work in the Parliamentary Assembly of the Council of Europe. We say that the norms, there shouldn't be the norms which violate the human rights. We know that soon and we will need potentially COVID passports to be able to travel to other countries of the world. I hope that such amendments will be supported at the committee, and the draft law will soon be voted for at the Verkhovna Rada. I understand that the system should be independent, so that there's no political influence, and it is very important to have institutional structure in place. Now I'd like to give the floor to Lada Bulach. Lada is one of the drivers of this process. I would like to thank you, Lada, because you introduced such a notion as public health. And I believe that we will step away from the term sanitary epidemiological well-being. How do you believe the system of public health should be designed in Ukraine? Good afternoon to everyone. Good morning. Today we'll be talking about importance of creating a new system of public health in the period of pandemic. I would like to thank all who participated and who are participating in the process of creation of this new system, the system of public health. I would like to remind you, on the 4th of February 2021, the Verkhovna Rada approved in the first reading the draft law 4142, and that is on the system of public health. This law has to create full-fledged national epidemiological service. The Center of Public Health will be strengthened. The network of regional centers of control and prevention of diseases will be created, and it's not correct when some people say that that's restructuring, rebuilding, or restoring old system, but that is not so. This is absolutely new system with new approaches, new values, and new opportunities. These territorial centers have no powers today, our laboratory centers, the centers of public health. They have no powers to provide permits. They do not do any inspections. The task of these new centers is to analyze the information, to identify biological threats, and to inform the ministry about possible threats and possible implementation. The law defines legal, organizational, economic foundations for functioning of this new system in Ukraine. The document introduces, that's the most important, that it introduces at the legislative level the notion public health as a sphere of knowledge and organized activity in the system of public health. And the task of the subjects will be to strengthen the health, to prevent diseases, and to extend the lifespan for Ukrainians. Also, the law will define the responsibility of the subjects in their relations in the sphere of public health. It differentiates between the powers of the Cabinet of Ministers, the Minister of Public Health, and other central executive authorities and local authorities. Also, the draft law defines operational functions or main directions of activity to ensure maximum high indicators of health. Summing it up, I would like to say I'm sure that all of you saw the law, saw all the norms. I would like to emphasize that the Parliament is working on this draft law today. Before, there was a lot of attention paid to it, and unfortunately, many mass media were manipulating the news. Unfortunately, the opponents were criticizing this draft law using the myths and manipulations as to mandatory forced vaccination, that as to indicating that that's a new system of bribes or some non-legitimate requirements to business. I want to negate all these myths and basically inform you again that we will continue to improve our law, our draft law, After the first reading, there were almost 1,000 amendments submitted by different colleagues from different factions, from different parties. Together with the Chief Sanitary Doctor, our committee and all the stakeholders are working on these amendments. That is why we are not submitting the draft law for the second reading, because there are many constructive pieces of advice in these amendments, and we are working on each one of them. Lada, but I'm sure that today we will, or during our next session, we will consider it, and I will be working with each one of our colleagues so that the Parliament gives its votes. But I would like to call for every stakeholders, international representatives, representatives of NGOs, foreign and national, representatives of executive authorities, please analyze this draft law and understand that it is important to find new opportunities but not additional problems. This should be treated as a new instrument which will make the system of public health in Ukraine maximum integrated and implemented to the existing system of CDC of the European Union. I hope today, in the presentations of our colleagues, we will hear how and what should we all do so that the law is approved, passed, and the most important is that it should be implemented by the government and by the Ministry of Public Health. Thank you, Lada, for your introductory remarks. Before I give the floor to experts, I would like to draw your attention to two things that you've mentioned. First is that the draft law suggests that there should be more emphasis not on control but on analytical functions. It's important. We need to analyze to fight against a pandemic. We shouldn't be scaring business. And second thing, you said that you are open to constructive advice, to constructive criticism. I welcome that. And that is why we have this discussion now. We see some of the problematic issues, and we would like you, the representatives of the committee, to pay attention to that. Now I would like to invite two experts, Natalia Kyrychenko, who was involved into the creation of the Center of Public Health in Ukraine, and Maria Bachmaga, who studied in the US, and she has the background in public health. They both understand very well foreign experience, and they understand how such experience could be implemented in Ukraine correctly. It's not always copy and paste. Thank you. Good afternoon, dear colleagues. I'd like to show several slides and tell you what our position is related to draft law 4142. This is very important draft law, and we support passing of it. The only thing is that we need to work more on it according to European best practices. In fact, we know that public health should play a very important role in reacting to infectious and non-infectious diseases. We know well about medical services. When we feel bad, we go to a doctor, to a hospital. That's the system of medical services. We know that, but talking about public health, average people, average citizens they know little, but public health has a large impact on the life and more impact on the life of people, more than the medical services. The task is to make it so that fewer people require medical services. During pandemic, what are the tasks of the public health? First of all, the system of public health is to ensure epidemiological supervision, monitoring the contacts, and the analysis of the data that are collected. They need to understand whether the school should be closed, or the border should be closed, or the vaccination should be conducted. So basically, we need data that could be trusted. That is the task of the system of public health. Also, another task is to offer measures that would make it so that people require fewer medical services, maybe to introduce certain type of testing during pandemic, monitoring of contacts, self-isolation, and another important function is communicating with the society and other authorities. Another group of functions is cooperation with medical system. The system of public health should provide methodological recommendations on the infection control, they need to explain or communicate about the needs in medical assistance, and also they have to coordinate where, how many beds will be needed. This should be done on the basis of evidence collected by the system of public health. And third very important thing is coordination and communication with other spheres, because reaction to pandemic, it's not just the system of public health that should be responsible for that. There should be coordination of different stakeholders. This should be recommended by the system of public health based on the data they collect. How should the social workers or police act, or should the military be involved? That is all that the system of public health is to do. We looked at how the system of public health is formed in different countries. Different systems, the different countries have different systems which depend on some historic facts, but there are some general features. First of all, the fact that the system of public health is autonomous. In every country, there's a body responsible for public health. It's usually attached, exists in the system of the Ministry of Public Health, but it has some autonomy, which is ensured by different measures. In some countries, the head of such center of public health is appointed by the president of the country, like in France or the US. In some countries, the head is appointed by international experts, like in England. In some cases, we see the appointment after recommendation of the Minister of Public Health. Another important characteristic of the systems of public health in the world is that they have a very clear structure and responsibility. If the system of public health is centralized, then there are territorial structures of the system, or the responsibility is with the municipalities. These are never the departments of the Ministry of Public Health in the regions. And third important component is professionalism. That is very important because public health should be separated from politics, even if the head is appointed by the president of the country, should satisfy all the professional criteria and should have a certain reputation with this specialists. There are cases when medical workers are appointed as heads of the system or bodies of public health, but they are trained specially in the sphere of public health. What do we have in Ukraine?
We all know what is going on in Ukraine. We have deputy minister that was appointed as also the chief sanitary doctor. And here there is we should have proper requirements to officials, and here professional and political issues coincide, and these people should be real professionals, not politicians. So we have a center formally, but the functions are limited. They are reinforced in the new draft law, but not significantly. And in the regions, we have some mess. We have chaos, laboratory centers of the ministry that do not have proper responsibilities, and regional centers of public health in the different regions. They have been created during the last 5 years, and now the decision is taken to liquidate them. So there is no proper distribution of responsibilities in the regions. The new draft law 4142 proposes a structure, institutional structure, that provides for the positions of the deputy minister, who is at the same time the chief state sanitary doctor, and also the Center of Public Health. We have sanitary doctors, chief sanitary doctors, and laboratory centers were renamed, and the structure does not provide for the risk assessment and risk management. And in 2015, it was recommended by CDC Center, and political and professional component, they are united, they are not differentiated. And what we have in the result, we have political decisions that are not often based on proper data. And we see examples such as quarantine on weekends, for example. And in this system, we have several problems. So these responsibilities of politicians who take decisions in professional sphere, there are problems in communication, there is lack of trust, and the trust is really important. Society should have trust in healthcare system, and we see it on the example of European countries. Also, institution that should deal with public health, it doesn't have proper powers, and the regional centers are under the deputy minister, and this politicizes the system, and this is really important. In this case, we do not speak about other norms of draft law 41, 42. There are a lot of important things, but many of them are declarative. And institutional structure is important for implementation. If we are not able to build professional structure, society trust, we won't have proper system that could prevent disease, and it will be only able to respond to some challenges. And now I give the floor to my colleague to continue with the recommendations. He is given the floor. It is sad to wake up in the country that breaks negative records once again. In some countries, they plan even picnics or going to the beach, but we continue to see the growth of disease, the number of deaths increases. So we should make proper steps to overcome this pandemic. This is a very bad situation. We should search for answers, not only to respond to current situation. We should understand what we are going to face in the future. These challenges will repeat. This pandemic is not the first one, and it is not the last one. And this draft law that we are discussing now is really important and timely. And on behalf of professional community, I would like to thank the deputies and our colleagues from the ministry and the healthcare center for this important work, because it is critically important for Ukraine in order to have a long and healthy life. I would like to say that we propose some ideas to this draft law that will improve this draft law to overcome the obstacles and challenges. And we work together with Ms. Mezentseva, and would like to speak about our pieces of advice. In order that the system of health care is successful in Ukraine and be able to respond to the challenges, it should be autonomous, professional, and should have proper responsibility. In order to be autonomous, the head of the Center of Public Health or the head of the system of public health should not be politicized. As Natalia Kyrychenko mentioned, imagine a situation, for example, the Minister of Healthcare resigns, and we know that such cases happen, and the deputies resign together with the minister if it happens during pandemic times, and the system of healthcare is without functioning officials. It is a catastrophe. That's why the appointment of the officials, it should be done through contest, or it cannot be a political figure. This should be a person who would be appointed in accordance with the contract for a term, and he may resign or be fired for different reasons, but not because of political reasons. Next is professionalism. the head should be appointed in accordance with professional quality, and the others also should be appointed because they are professionals, not politicians, politically appointed people. And of course, there should not be only medics. We know that public health is not a clinical profession. There are many other specialists, including specialists in communication. We see many examples of this. It is really important to timely communicate about everything that is going on in order to avoid confusion. And the last aspect is responsibility. For this, we need clearly defined functions specified by law and areas of responsibility, and clear and simple subordination of centers at the regional level. And we should know who is responsible for collection of laboratory data, who should transfer them at the national level. At the oblast level, we have 20 organizations that do not have proper communication. They communicate through Kiev. If we continue with this situation, then all the answers to any challenges in the sphere of public health will be inefficient. So here we have a scheme. We reflected what we have in our amendments to this draft law that we submitted, how it should look, the system of public health. We see that the role of the center should be reinforced. It should be subordinated to the Ministry of Healthcare, but at the same time, it should be independent in its activity in order to improve health of Ukrainians. So the center should have a proper approach, like in business. And we propose to have a supervisory board. This is an acceptable practice to have the supervisory board like in other countries. It may consist of professionals, politicians, representatives of the public. This will help to build trust to the Center of Public Health. Also, Oblast Center of Public Health. And we should not duplicate the functions at the oblast level. Everything should be done in one structure. Proper responsibility should be allocated and proper financing should be given. And also proper communication should be established with the national health system. The centers they should cooperate closely with the departments of healthcare, with departments of other areas in order to efficiently introduce the policy of public health in the oblasts. World experience shows that for efficient functioning of public health system, first we need political will. And I read a successful story of Taiwan, how they continued to fight with coronavirus. They didn't have lockdowns, cafes, restaurants, they work. Why? Because they had timely response at the end of December 2020, when first cases appeared. They had an algorithm how to respond, and they introduced this algorithm, and they have political will, and I believe that this is due to the fact that Vice President is epidemiologist. And we may only envy them and take the example how to efficiently fight with pandemic, and at the heart of this, we should have innovations. We cannot use only Soviet approaches. Now we have pandemic. When it ends, we understand that Ukrainians suffer from non-infectious diseases and also psychological health problems exist, and it influences longevity and quality of life. And for the state, this is loss of GDP because sick people do not work and do not pay taxes. So the answer to coronavirus, we see that we lose economic resources due to these lockdowns and confusing situations. If system works and uses proper measures that are timely or even go forward a little bit, so these losses may be prevented. All measures of public health should be really technical, clear, should be based exclusively on scientifically proven measures. So this lockdown on weekends, we see that non-professionals invented it. They do not understand the nature of spread of the virus. The virus doesn't care whether it is weekend or not. This is an absurd. And several other elements. Management is important. We should have proper institutional structure, proper subordination contracts and mandates. And also partnership. Public health doesn't work in a vacuum. It may propose measures of response. It should first analyze the data. It should find any disturbing signs, not only concerning infectious diseases, but any threats that may threaten health. For example, in the city, for example, if we compare it with another city or town, for example, we see that mortality in children increases, then the center should define the reason. They should study the cases. They should find out, for example, whether this is a coincidence or it may be connected with something else. Based on the analysis of the data, partnership should be formed with other bodies of power, with society, with private structures, in order to timely provide proper response to all the challenges. And one more important aspect is communication. I believe that we may not explain what it is. We all understand that this is really important. Everyone uses phones, computers. People do not read printed paper. The communication should be clear, and it should be provided to people through media that people use. This information should be clear to people. I would wish you all good health, and I thank you for our joint work on this draft law, and I hope that soon we will have the system of public health that will be efficient, and it will be able to overcome all the challenges that we have in healthcare system. So before giving the floor to our foreign expert, Brandt Siegel, and I would like to thank these three women, Maria Mezentseva, Natalia Kyrychenko, and Maria Bachmaga, for submitting all these amendments in order that the structure become independent. I understand that the Committee of Public Health indicated that they got thousands of amendments. This is really a lot. This is really complicated, but we will be really glad if committee pay attention to this institutional structure. This is a basic thing. And you've mentioned the example of Taiwan. It is really important to indicate this aspect. Maybe it is political, but we should take this into account in order to professionally fight this problem. I would like to give the floor to Brandt Siegel. America also faces COVID, and it would be really interesting for us to hear about your experience. We have a rigid timing. Please, maybe in 8 minutes, you will be able to speak about your system of fighting pandemic. Thank you.
Well, thank you very much for the introductions. On behalf of the Defense Threat Reduction Agency, I'm very grateful to be with you and to speak about this important topic to Ukraine and to the international community. Again, my name is Brandt Siegel. I'm the program manager for Europe and Ukraine for the Biological Threat Reduction Program. I am not an expert. But I'm learning an awful lot by listening to this dialogue, and I'm very pleased to be part of it. So unfortunately, I can't comment on a lot of the United States experience, as I'm not an expert in that area. But I do want to thank the thank all of the organizers and thank the distinguished guests for allowing me to listen and to contribute to the dialogue. And I also want to thank the Ministry of Health for their partnership with our program since 2005. We've been working to improve sequencing capabilities in response to COVID-19 and are now in our 3rd year of epidemiology training at the Interventional Epidemiological Service of the Public Health Center. And over the years, we've provided significant amount of support to laboratories and staff in Ukraine. And that's why it's very important to us how the public health law proceeds, how it's developed, and how it's implemented. And we've known since the beginning of our program in Ukraine how important partnership is to global health security, and this pandemic only makes that all the more clear. So that's why I'm pleased and encouraged to be part of this dialogue and to discuss the public health law. It's also why it's so critical that that the Biological Threat Reduction Program, that partners from the European Union and WHO and the international community at large have a clear understanding of the Ukrainian public health system and how this law will reform that system. How DITRA and the Biological Threat Reduction Program continues its support really depends on this law. And so it's vital to have this dialogue and with global experts. And the one message that I hope to deliver is that you're not in this alone, that there are many international experts who we all can learn from in this effort. And I think this forum is a very good example that you have taken that to heart, and I encourage you to continue that. And also offer this program's support in that effort. So I won't take too much time because I do want to continue to hear from some of the experts and to learn from that. I just want to say thank you again. Thank you for this dialogue, and thank you for the work that you're doing to develop and implement this very important law.
Пане Брандт, якщо я вас правильно зрозуміла, то ви
Understood. You propose to us the help of international community to improve the draft law. I think that Mezentseva address the attention to European and Euro integration approaches. Many people in Ukraine want to build this proper system in Ukraine, and thank you for your time, for joining us. I understand that you have night time. Now, thank you very much for joining us. And I would like to give the floor to the director of the Center of Public Health, and we understand that your center really deals with the pandemic, with COVID. And we would like to know about your work. Whether the absence of this law limits your activity in fighting the pandemic. And how does draft law should look like, the draft law on public health, in order that it be able to help you as the Center of Public Health to fight COVID and not to create problems. The floor is given to Roman Rodyna, Director of Center of Public Health. Good morning, dear colleagues. Thank you for this opportunity to participate in this round table. Please put my presentation on the screen. And this presentation reflects the main aspects that are envisaged in this draft law. So please, I would ask you to turn on the slides. First, the first slide, this is the system, the structure of public health that was proposed in the draft law. We see that the Ministry of Healthcare, it coordinates the activity of Center of Public Health and also coordinates the network of territorial centers of control and prevention of diseases. The Center of Control and Prevention of Diseases, these are the institutions that should implement the main functions in the region concerning public health, and coordination of this network should be done through the Center of Public Health. So these are the main areas that are coordinated by the Center of Public Health. I would like to say that now, in accordance with the order of the Ministry of Healthcare concerning epidemiological supervision over the infectious disease, the institutions are appointed that deal with epidemiological supervision. And on the slide, we see the structure of management. We know that we have chief sanitary doctor, and in the centers there are chief sanitary doctors in the regions. Why this structure is needed, I will tell you in more detail later on. Next slide. Those areas I've mentioned concerning coordination of the Center of Public Health and the regional centers, these are the main areas that are on the slide. We have information fund. There is such a notion in the draft law. This is about collection of all the information concerning epidemiological situation and the health of people. Also, there are programs of prevention and coordination of the programs of prevention, and also laboratory research coordination. We have reference laboratories for quality system, and they are placed in the regions, and also issues of bioprotection and biosecurity in all the laboratories that are pathogens, and they should be kept safely, and this is the basis of proper work of these laboratories, and also program of treatment of tuberculosis, HIV, and hepatitis. Also, there is a platform for training of personnel for public health, and we plan to develop this platform in order to have functions to prepare qualified staff that will work in centers of control and prevention. Next slide. Centers of control and prevention of diseases in the regions. What are these institutions? First, these are legal persons financed by the Ministry of Healthcare. They have independent budget, and they have material and technical basis, and they will be created on the basis of laboratory centers of the Ministry of Healthcare of Ukraine, and also these centers should consolidate the main functions of public health in the regions. We know that in accordance with the order of the government, the workers of the centers, they are transferred to these centers. The workers are transferred to these centers, and we should provide proper powers in order not to have this aggregation of powers at the local level. We should provide aggregation of these functions in order to efficiently manage them. Next slide. Here we have the main departments in the centers of control and prevention. This is operative and dispatcher unit and brigades of operative response. And the speakers mentioned this, that these centers, they should become analytical structures that should provide for collection analysis, systematic analysis of information about public health, not only infectious, but also non-infectious diseases. And this should be an analytical function that is really important. In previous systems, when we had sanitary and epidemiological service, checks took a lot of time, and they lack time for other activities. And these centers of control and prevention should have systematic assessment of risks in order to provide proposals concerning management decisions, and also response to emergency situations of big scale. And on the next slide, we have the main functions of the centers of control and prevention of diseases. As I've said, these are immunological supervision and identification of infectious diseases, and also we should have a powerful laboratory structure, response system in healthcare system, also studying of origin of diseases, and also recommendations to implement measures to improve healthcare indicators, and also collection and processing of information. And the next slide. So are the important functions of the center. These are periodic analysis, monitoring of measures concerning improvement of health, and also information analysis concerning trauma and violence, and also periodic reports, training, information and awareness campaigns, and this is also important for improvement of health of population on the whole. Also, they develop state medical sanitary norms, and also they provide for sanitary and biological well-being. The next slide. The function of chief sanitary doctor of Ukraine. As you may see, he provides to the central bodies of executive power. He makes submissions to prevent risks to health and well-being, and to investigate the cases of infectious diseases outbreaks. And the system we had before until 2020, it didn't work for prevention. It was not able to prove that in conditions of challenges such as COVID-19, it could respond quickly. That's why Ukraine needs an instrument due to which we will respond quickly to the risk. The chief sanitary doctor in Ukraine and in the regions, these are the instruments that would provide the quick response. Sorry for interrupting you. They establish quarantine. They also convene meetings to take proper decisions to prevent spread of disease and to prevent threat to public health.
The next slide, and I would like to emphasize the chief sanitary doctors. The main thing is that now, what is now in the law and is supported, and that is that the centers of control and prevention of diseases without routine supervision will have such powers when reacting to emergency situations, because when reacting, it is important to apply immediate measures to prevent consequences. If some object is the reason of the outburst of a disease, then it is very important to apply some immediate measures. And on that, the health of all the people will depend. We welcome the fact that the law talks about the regional centers and the chief doctors, the heads of such regional centers, to submit, to make submissions. And that is very important during different emergency situations. Roman, can you hear? Can you hear? Can you hear? You need to wrap up. Now we see, unfortunately, we have only one yellow zone, and we will need to very efficiently counteract the dissemination of the disease. Also, the powers are to organize the meetings of the Commission, and this is to be approved by the central authorities, and the Commission will be set up to prevent dissemination of infectious diseases. And also another function is to allow visiting different enterprises, and this is to prevent the dissemination of disease. That is the concept that was approved by the Center of Public Health, and I support this concept. We need to be sure that we receive the effect that we need. The main sanitary doctors include the objects which are recognized as problematic after the special inspection is done. Then the sanitary doctor can include such object into the plan of measures of the state control. And as you see, this is to be done immediately after the chief sanitary doctor informs about some infectious disease. That was the last slide, and in the end I would like to thank all who participated in drafting the law, and I would like to request the MPs, understanding that there are some technical amendments which are to be introduced, but please speed up passing of this law, because that is the law which will change the whole system of reaction. Thank you. Thank you, Roman. A technical announcement for speakers in Zoom. Please stick to the time limit. Has Victor Leshko joined us? If not, then we continue. Do we see? No, he hasn't joined us. Okay. And now, from what Roman said, we understand that the model is supported when there is the sanitary doctor and the Center of Public Health. That's what we are talking about. We want the Center of Public Health to be independent. I would like to give the floor to Fedir Lapiy, who is the head of the National Technical Group of Experts on Issues of Immunization. You comment a lot, you are professional in the sphere of immunization. What is your position as to this draft law? Just 5 minutes, not more. Good afternoon to everyone. Good afternoon, colleagues. I represent the National Technical Group of Experts on Monoprevention. The public health is more than sanitary epidemiological service. Tobacco, smoking is public health. Everything which is about preserving the life is public health. Talking about vaccination, that is a component of the public health. How should decisions be made so that they are correct, not biased? Because I know how what was happening with vaccinations before 2014, after 2014. There are groups of experts on monoprevention. They are independent, but they are advisory groups for the Ministry of Public Health. There are also universities that have scientists, and they also express their opinion. And public health, that's not just medical doctors. Once we are talking about what happened after 2014, then my position would be, let's wait till the Center for Public Health of the Ministry of Public Health of Ukraine is set up, and then on the new platform we will create a new national team of experts on issues of monoprevention. Do we need the specialists on public health? But if we change the name of the chair of hygiene to the chair of public health, nothing will change. Such specialist is to be trained specially. Then I would like to reveal you one more secret. Very often people ask, who are the members of the National Group of Experts? We have epidemiologists, infectionists, virusologists, and there's Maria Bachmaga, who's the member of the National Group of Experts, and she's the specialist on public health issues. Now, how does it work over there. I'm not talking about one group. In the USA, there's a ICP for which the secretariat is not a secretary, they have CDC. This for the population of 300 million people, they have in this center, in this secretariat, they have 65 persons only. They do all the analytical work. They submitted to the National Technical Group, and they submit what they have developed, and people analyze. And then in Germany there is TICO. The secretariat, the Institute of Robert Koch, is the secretariat. It's a huge scientific and research institution. But how important it is to have a balance so that there are no biased decisions. The mistakes are to be avoided. Let's return the institution of chief specialists. What if the chief specialist stays in his position and issues some wrong documents? How to neutralize that? And that is something that one person can produce, just like a czar. This system should exist irrespective of how political authorities change. Scientists are to be part of the system. They should be independent, and they should be expressing their opinion. Before 2014, I know how it was when we are talking about the calendar, vaccinations, and about other things. I want, after 2014, to have it like they have in other countries, when political power is changing and the specialists are there. When we are talking about draft law, the system cannot exist without law. That's the issue of financing. These are legal issues. That's what we see with vaccination against COVID-19. Sometimes people say we will do everything ourselves, and there's a lot of harm here. There are many issues related to vaccination. These are local issues. When we are saying that there will be the law will allow to create a system, a structure, to know what we finance, who we are subordinate to know what we analyze. And that is something that is important for the national security. We are making steps in the right direction. And without the law, we will be unable to move forward, especially when it comes to this component, secretariat. Thank you, Fedir, for your presentation, for additional arguments, and that this institution should be politically independent. I would like to give the floor to Oksana, who is the representative of the Office of the President of Ukraine. Just take 2-3 minutes. Thank you for inviting me. Thank you for this important topic that we are discussing. The system of public health is what allows to ensure different national interests, and that's one of the priorities. To continue what we started discussing, I would like to draw your attention to the fact this system is to be created not from the structure, which is so important, and we've heard different opinions on how to build it up correctly. I understand that we will work hard on amendments to this draft law, and the legislators will create a final document of high quality. Also, what is important for us is counteracting the threats and challenges which could harm public health. Just like COVID pandemic, there could be other challenges without the system of high-quality scientific research, without the system of innovation laboratories, without the system of hubs which will allow to improve the knowledge and to be competitive with the scientific research which would allow implement other innovational measures to counteract viruses. That is important, and we see how difficult it is for us to move forward without such capacities. That's why we're working on mechanisms to ensure the growth of innovations so that we can improve our research component, scientific research component, which would ensure the protection of our state and of our national interests. Thank you. I believe that this work means many steps which cannot be made in a day or two. But discussion of the draft law is the first and very important step which needs to be developed. Thank you for being so active. Thank you for submitting all these amendments. Thank you. And we will hope that the Committee of Public Health will be open to all amendments. We have one more speaker online, Oleksandra Yanovska from the Representative Office of EU in Ukraine. Just 5 minutes. We will appreciate the position of the European Union. We know that a couple of years ago, European experts made assessment of epidemiological oversight of infectious diseases. So please tell us what is the position of the European delegation. Thank you.
I'm very happy to be here today. Can you hear me well? Yes, okay. So I'm Oleksandra Yanovska. I work on health issues in EU delegation. I would like to say that I am not a public health expert. We have a dedicated project. It's a very important area of reforms for the EU, and we have been supporting the Ukrainian government in this area already for some years. And we have a dedicated project with an expert team who have been actively involved in this reform so far. We have sent our first comments, I think, already back in November last year to the Ministry of Health. We have formulated specific expert comments later on as part of the working group that was organized to support the development of this draft law. We are very thankful for being able to contribute to this very important reform. I just would like to say there were so many very specific expert comments already. I would like just to maybe mention some areas where we feel the current draft really needs to be strengthened. It is very good that Ukraine is about to prepare and adopt such an important law that really presents for the first time a public health system. But we really think that there is a room for improvement in this draft law. So we really hope that our expert comments will be taken on board. among the comments that were shared with me, I would like to also underline just a number of them, linked to the definitions and the completeness of the law, linked to the role of prevention, disease prevention, linked to governance and to the architecture, let's say, of the system, and finally to the resources allocated. So in terms of definitions, we would welcome to have a really clear reference to long-term public health priorities and strategies that should really ensure that this broad objective is defined, is there, and it should really help also during the implementation stage. Shall I speak slower, or it's okay for the translation?
It's okay.
Okay. So it's important to have this long-term vision and define the priorities, even if maybe they are something they're obvious, but it's really important to put them in the law. Also, we would advise to embed this law in around the 10 essential public health operations. This is an international best practice, also supported by WHO. So where the strong public health system is usually built on 3 key pillars: health protection, disease prevention, and health promotion. Of course, many of the elements are already in the law, but it's really good to be systematic and to use these 10 public health operations to sort of structure the document. We would think it would make it easy to read, comprehensive, and structured. And in this context, experts also advise to introduce provisions ensuring quality assurance. It's important to cover such issues as tools for licensing, evaluation, certification, and accreditation mechanisms. So I understand they have not been included so far in this draft law, and we really recommend to include those. And especially in 3 priority areas: blood transfusion, hospital infections, and hand hygiene. This is so far on definitions and objectives. Another point I want to make is about the role of the public health center. We heard from some speakers already that it is supposed to be strengthened. We would be very glad to see this happening. Yet, the way it is formulated now, it is really not very clear. It brings me to this point on the overall governance of the system, of the role of the Ministry of Health, of the role of the agencies, the role of regional centers, public health centers. The elements are there, but so far experts assessed that the presentation was maybe not very clear and really needs strengthening to present if it is a public health center, this agency who is supposed to do the technical work, then it should be clear, the names should be there to avoid really problems later. This would be our recommendation, to really strengthen the role of public health center and to clearly define its autonomy and lines of accountability vis-a-vis Ministry of Health. And the last point I want to make, it's not an exhaustive list, Our experts are ready again to have dedicated meetings, discuss this, send comments on this. But the last point was about strengthen the role of non-communicable diseases, the prevention in this draft law. Somehow it was felt that so far it was maybe not covered enough. That's all from my side. And again, very happy to be here and to contribute to this very important reform. Thank you.
Пані Олександра, дуже дякую вам за коментар.
Thank you, Oleksandra, for your comment. I'm happy that the international community has also joined us and is also providing comments. And now everything will depend on openness of the Committee on Public Health at the Parliament and their desire to take into account all these comments. Now we proceed with the questions. I see that all the journalists left with Fedir, Lapiy. They are all interested in issues of immunization. I would like to ask the colleagues from the UCMC whether there are questions. No, we haven't received any questions. Once there are no journalists and the journalists are talking to Fedir, then I suggest that we finish our event. Thank you all the speakers, thank you organizers, and I wish us all good health and good day.